Hey world, good Sunday afternoon. This is Dr. Rico Short coming live. And I'm here to answer any questions that you might have about dentistry. Any questions you might have about root canals in particular. You guys know that, I'm a board certified root canal specialist. And I do a lot of work just basically teaching people how to save their teeth. As far as dentists are concerned, there's a lot of dentists that follow me around the world, and I know there's not access to a lot of technology that we have here in the United States. So I want to be able to come to you guys live on this Sunday, and normally on Sundays I don't go live on Sundays. I want to go live today to kind of answer some questions that you might have as a dentist, if you're a dentist, or if you're not a dentist, you're a patient wondering about, should you save the tooth? Should you take the tooth out? Which one is better between an implant or a root canal? How long do root canals last? How long do implants last? What's the best option for you? So on and so forth. So I want to come on the Sunday live to answer any questions that you guys may have. So I see you there, Dr. Johar. I see you live. I see you, Dr. Jim McKay, Morgan. And I'm live here. I'm live. So I'm here to interact with you, answer any questions that you might have about root canals versus implants. I know Dr. Jim McKay, she does a lot of implants, does great work out there. And you as a patient, you might be trying to figure out, what should I get? Should I get an implant? Should I get my root canal? And those kind of things. Some of the docs out there, you guys may have questions about what's the latest in endodontic technology. What's up with this GentleWave? Do I need to have this GentleWave? What's up with the Cone Beam 3D machine? Which one should I get? What are some pros and cons of the 3D imaging? What about file systems out there? There's so many different file systems. There's rotary file systems. There's reciprocating file systems. There's different types of instruments. There are that you can use. There are nickel titanium heat treated files. They are regular type of files. What about obturation systems? Is it best to do one vertical? Is it best to do, single cone? What about lateral condensation? I see you sipping T-Ab, and I see you apping Apine Doc. I'm here to answer questions that you guys have about root canals, about root canal techniques, root canal technology, things like that. So if you guys have any questions, just throw them out there on the chat so I can answer some of those questions for you. I see you, Jay Laron, man. I see you. I'm talking about root canals, and should you save your tooth? Should you get your tooth taken out? I know that your wife is a dental hygienist, if I'm not mistaken. So dentistry is the topic on Sunday. That's a great question. Jay Laron, he said, do they hurt? Do root canals hurt? Thank you for having the courage to lead this thing off, Jay Laron. So root canals, if they are done properly, they should not hurt. That's right. Root canals should not hurt if it's done properly. Now, this is the key. If you have been hurting for months and months and months, and you expecting to go in there and you get a root canal and everything is all good, you go from a 10 in pain to a 0 overnight. No, that's just not gonna happen. The studies show that if you have been in pain for a long time, your healing is gonna take a little longer. So does that mean it's going to hurt while you're getting the root canal? No. But afterwards, the area is going to be a lot more sore, as if you were only in pain just for a couple of weeks or something like that. So that's the biggest myth. Do root canals hurt? They shouldn't. If they're done, most root canals, people don't know this, most root canals are done by the general dentist. About 80% of the root canals are done by the general dentist, and only about 20% of the root canals are done by people like me, who's an endodontist, the root canal specialist. And so my job as a root canal specialist is to equip the general dentist on how to do root canals very efficiently, very pain-free, with a high success rate, because they are seeing most of the root canals out there. I know that some of my colleagues out there, they think that general dentists should not do any root canals, and I don't agree with that. In fact, if they didn't do root canals, then everybody will be hurting, because there's not enough endodontists to take care of all these people. So I'm grateful for all the dentists who do root canals. I'm even grateful for the dentist that knows when to refer. The patients will be thankful as well. So that's a good question. Thank you, Jay Laron. So we got a question by Sippin' Tea. What type of medication should be taken after receiving a root canal? Great question. So traditionally, I mean, even I've been in practice now over 20 years, and I used to always give my patients Vicodin. I was like, I'm just going to give you Vicodin. I'm going to give you some Vicoprofen. I'm going to give you some, some kind of narcotic. Well, studies show that you can give a combination of ibuprofen and acetaminophen. And my favorite combination, I'm telling you guys some free info, man. You don't got to pay for this. If they can take NSAIDs and they can take Tylenol, the best combination, studies show that they do 600 milligrams of ibuprofen and 1 extra strength Tylenol, which is 500 milligrams of acetaminophen at the same time every 6 hours. That's just as effective, actually more effective than a narcotic, more effective than Vicodin. So that's what I would recommend. And I'll give them that right after the treatment procedure. You don't want to wait till the numbness wears off and try to get into their system, because it's going to take longer, and it's going to take a lot longer for that concentration to get in their system to work. So you want to give it to them while they're still numb, and the body can, quote unquote, absorb that medication. So when the numbness comes down, the pain medication is coming up so that they have an even landing strip. They can land the plane without a whole lot of pain. I didn't mean to rhyme with that. It can land the plane without a whole lot of pain. And guess what, doc? They will thank you for that. They were like, oh my God, man, that was a great experience. So that's my go-to. Now, if they can't take that, I got some other tools in my toolbox that I can give. Great question. So Dr. Jim McKay says, would you add a steroid or anti-inflammatory? That's a great question. So I don't give that often. And the reason is because steroids have more side effects. And some of the studies show that the steroid anti-inflammatories they're not as good versus the NSAID combination with the acetaminophen. So I would have the steroid anti-inflammatory in my arsenal if I need it. Now, when would I use that? I would use that if patients have a flare-up. So if you've been done endodontics long enough, especially with retreatments, when you clean that tooth out and that tooth has been infected for a long time and you pack it with calcium hydroxide, the reaction between the calcium hydroxide and the bacteria and its byproducts inside that tooth, some of that gets pushed out into the periapical tissues, and they can mount a severe immune response, severe pain, severe swelling. On those cases, Dr. Jim McKay, I would give them a Medrol dose pack, because the narcotics will not be as effective as a Medrol dose pack. And a lot of times I would cover them with an antibiotic as well. So that's a great question, but that's not my first go-to. My first go-to will be the combination of 600 milligrams of ibuprofen and the extra strength Tylenol. And I tell them you can take that every 6 hours as you need it for pain, but you shouldn't have to take that any more than 3 days. That's the key. 1, 2, 3. If they have to take that more than 3 days and something is going on, they need to contact your office. So that's a great question. So let's see. How are root canals different from extractions, or are they the same? That's great. So I'm not sure if you're talking about, I'm assuming you're talking about pain-wise. Well, when you do a root canal on a tooth, you're not removing the periodontal ligament, and you're not really manipulating the bone a whole lot. So that's where the different pain thresholds and stuff comes in. That's why I believe, and that's I need to research that to see what do the studies say about root canals versus extractions as far as the patient's pain tolerance, which one is the most, uncomfortable. Now, a extraction is more or less a surgical type of procedure versus a root canal that's not. So if I were to go out on a limb and guess, I would say a root canal done properly is less painful than having extraction, which is a surgery, because that's exactly what it is. Any other questions out there that I could answer about root canals, especially? And I don't go on live often, so I'm throwing you guys some filet mignon right now. I don't go live often, so I'm throwing you guys some filet mignon. So let me talk about this. I wrote an article that talked about cone beam CT, which most of you guys probably know about cone beam CT. Should you have one? Is it a standard of care and things like that? Well, I'm just going to tell you right now, cone beam CT, at least right now, is not the standard of care. It's not. Now, it's a great tool to help you find certain canals that may be missed, looking at other types of anatomy in the tooth. And also, if you're doing a lot of surgery, particularly endodontic surgery. It lets you know where the important anatomical structures are so you can avoid them when you're doing those things. But the cone beam CT is really sold based on the premise that it's going to show you where all the cracks are, the micro cracks, so you can decide if you want to take the tooth out or do the root canal. And that's not true. The cone beam CT will show you cracks, but it won't show you micro cracks. You won't be able to see them. The sensitivity is not specific enough to show you where they are. And I've given this information out in my lectures many times, and I know some of the cone beam people say, "Oh, Dr. Short, don't say that." I'm like, no. I got to tell them the truth. I got to tell my audience the truth. But cone beam CT is really good, though, if you have certain types of fractures that on teeth that are not root canal filled. If the tooth has a root canal filling material in there, due to the gutta percha, the barium in the gutta percha, which is the radial pacifier, will keep you from being able to see that crack that's in the tooth. And if it's a micro crack in there, forget it. You're not going to be able to see it. So you'll have to do the root canal under the microscope. And that's how you can usually see those micro cracks if it's from the coronal apical area. If you have a crack from the bottom up or mid-root crack, a lot of times you won't be able to even see that. If you're doing a standard non-surgical root canal, you have to flap the tissue and look at it. And actually you assess it and you see that it needs to be extracted. Now, there are some bone patterns that you can see on a cone beam CT, and you can kind of determine if there is a crack based on a certain type of bone pattern that you see on cone beam CT. And from that, you can usually recommend a patient to have the tooth out versus spending money on the retreatment or the root canal. So I got another question is from Sippin' T. Is the patient spread for endodontics minimal because general dentists can perform root canals? Is the patient spread for endodontics minimal because general dentists can perform the root canal? So most endodontists are more or less retreatodontics. Most endodontics that I do, I would say at least 70% of what I do is retreatments. And that's kind of has turned to be our bread and butter, because most of the root canals, like I said before, 80% of root canals are done by the general dentist. And so we end up, usually over a period of time, retreating, a portion of those. So because, as a general dentist, I used to be a general dentist, man. And I remember, trying to do a fast root canal. Everybody want to do a fast root canal, and you can't do root canals efficiently, effectively, and fast like that. You have to take your time. You got to find all the canals. You have to open these cases up to at least a size 25 if possible. And the reason is studies by Chow show that the irrigation, if you're using positive pressure irrigation, and also maybe some negative pressure irrigation too, that's a whole other topic on endovac and all those other kind of things. The apex has to be open to at least a size 25 for the irrigants to reach down to the apex. So you have to make sure you open those canals up so you can get the irrigation at the apex to make sure you clean it out as much as possible. I see Dr. Jim McKay say, I think it's more important for implant dentistry. So let's see. I see some other doctors coming in. I'm answering questions about endodontics and what I do, and which systems out there are the best, which one you should use. I'm talking about pain medication. I'm talking about all those kind of things. I was talking a little bit about cone beam CT and endodontics because I wrote an article on that about 4 or 5 years ago. Basically, I'm dispelling some of the myths about it, and I think cone beam CT is great in endodontics. It definitely helps us find a lot of issues, especially you have those cases where, they're hard to diagnose. You got a crown that's calcified and a couple of crowns there. Patients is an older patient, nothing, the bone is thick, you don't really see anything. And what I used to tell patients, if I can't pinpoint the issue, what I say, hey, Ms. Jones, the best thing to do is give it some time. And a tooth issue is going to localize. And that's what I used to do. I send them home and it'll be 2, 3, 4, 5 weeks. And all of a sudden the pain localized and they come back and boom, this is the one, and we diagnose and we treat it. Well, cone beam CT allows us to have a more in-depth view of what's going on the bone. And it's really specific. So it really helps us find out if you have a lesion on a particular root, whether it's the mesial buccal root, distal buccal root, or palatal root of an upper first or second molar, it will actually give us clues to know that is that tooth necrotic, and it can actually give us a guideline of should we go ahead and open that tooth up and relieve that patient of pain versus putting them out the office and say, hey, give it some more time. I saw somebody asked me, why did I choose endodontics? So endodontics kind of chose me. I was happy being a general dentist. I was in a small town called Columbus, Georgia, working with a mentor of mine. And, from a business standpoint, it did not go the direction I thought it should go in. So I had a friend of mine that was actually in an endo residency down at Nova Southeastern in Fort Lauderdale. And I chose to go and visit Fort Lauderdale, not the endo clinic and none of that stuff. He ended up having a situation. He's like, hey, I flew in, and he's like, hey, I'm gonna have somebody pick you up. I need you to come by the clinic. So he was doing a root canal under a microscope. This is the first time I saw a root canal done under a microscope in 2000, I think it was, or around there, 2000. And I was kind of fascinated with that. I was like, man, that's pretty cool. Like, real cool. And so I said, but nah, I'm not ready. I don't want to go back to school. I'm done. And then I left, and then I was still in my same situation. And he said, hey, man, you ought to think about doing endodontics. And I was just like you, and you'll learn to love it. And I was like, all right, I'm apply to a program. And so I was like, okay, this is Tuesday. I said, when is the deadline? He says Friday. I'm like, are you crazy? So I was like, all right, let me get all this stuff together. I got everything in order. I sent everything out. And then I got an interview. So I went down an interview, and the program director said, hey, you're the guy that came down here to spend time to learn how to do a root canal. I'm like, yeah, that's me. Reality, I went down there to enjoy a vacation on South Beach. That's just the God honest truth. So I ended up going down there, and I just kind of like, yeah, sure, I love endodontics is what I want to do. Interview went well. And then I went back to Columbus, Georgia, practicing, and I got a letter 3 weeks later saying, hey, thank you for doing your interview. We were interested in you, but unfortunately, the spots were filled. And there are only 4 spots, and there's probably about 2,000 people who apply for these 4 spots. I'm like, okay, all right, well, I guess it wasn't for me. So about 2 weeks later, I got a phone call. I was working in the office and said, hey, Dr. Dorn is on the line. He's from Nova Southeastern. You want to speak with you? I'm like, sure. I'm like, what does this guy want to talk to me about? So I got on the phone. He said, hey, Dr. Short, there's something about you I like, and we've never gotten 5 residents, but I want you to be the 5th one. I'm like, what? I was like, man, I knew because of my background and understanding, that I know what the number 5 is. 5 is the number of grace, God's merited favor found in the finished work of Jesus Christ, and that's for me. And I was like, man, this is it. Now, I didn't come to that knowledge back then. It just kind of came to me a few years ago. So then I took the offer, man, and I went down there, and I didn't like it. I'm going to be honest. I mean, I was getting headaches looking through a microscope, and it was so much work, so much lit review, and I had to read all this and read all this. I'm like, man, I made a wrong decision. And I said, I thought I knew how to do root canals, but the way they're teaching me, they're telling me to throw everything I know about root canals out the door. We're going to start from scratch. And it was like torture. And I didn't like it. And over a period of time, like anything else, as you continue to put one foot in front of the other, and then you kind of learn to like it, and you start adjusting, and then you start seeing things meet up. You start seeing the literature meet up against what you're doing in the clinic, and then things start connecting, and then you just kind of fall in love with it. And that's what I did. After my first year, I started falling in love with doing root canals and ended up graduating and going to the next step of becoming board certified, and ended up teaching and writing all these articles. You see the short case of the day. I've written over 1,000 articles on cases and trying to educate general dentists as well as the public about what we do as a root canal specialist. Believe it or not, the public, there's only 20% of the people in the public that really know what we do. 80% of the people don't even know what a root canal specialist is, don't even know what an endodontist is. And I'm like, all right, that's going to be one of my tasks before I leave this place, man. If I can make sure 50% of people heard of an endodontist, know what a root canal specialist is, hey, God, I've done my job. So I've been doing this now in my own practice, 17 years. and it's been full of hills and valleys. Most of you guys know I had a terrible eye injury last year, and I thought I was going to lose my eye and my vision, and I had to shut down my practice. I thought I was done with clinical dentistry, and by the grace of God, I had surgery on my eye, and they didn't know how I was going to be able to come back from that. And I ended up coming back just as good, like nothing ever happened. And God was able to help me sustain my practice. And now I'm back there full time, taking care of people and doing what I love. So that's a great question, Sipping Tea. Anybody else got any other questions? I got about another 3 minutes that I want to entertain questions. And I mean, people want to know. Some people ask me about my books, man. I'm an author as well. So my latest book is called In the Eye of a Storm, 45 Days of Turbulence and Peace. This actually talks about my journey going through my eye injury. And it talks about not giving up. It talks about worshiping while you wait. It talks about laughing away the disappointment. That's right. Literally in day 5, laugh away the disappointment. And I have to read my own stuff, man, because when I was going through that eye injury, man, all that stress that was on me, I'm like, man, I have to channel this some way. And guess what I started doing? I started journaling. And I hated writing. I started journaling. I started writing these things out. And God inspired me to say, look, we're going to put this in a book. I'm like, really? I said, nobody's going to buy this book. Nobody's interested in my journey. And then I realized as I published it, man, people from all over the world have issues. You have issues. I have issues. Now, social media is going to make it look like everybody got everything together. In reality, none of us do. We all have issues. We all have problems. We all have insecurities that we have to work through. So I put the book out, and the book is doing extremely well. And at the end of the day, I wanted to make a difference in lives, and that's what it's doing. And I'm so happy and so grateful for that. So thank you, Sipping Tea, for that. I see you, Dr. Gilbert, join. I see you, Money Monday, join. I see you the first heat wave, Max, radiologist, Kenya. I see you there. Tanola, this is so timely. Any advice for young dentists applying to endo? Oh, great. So if you are a young dentist applying to endo, one of the main things I would say is try to get on somebody's research project, because that's heavy. Get on somebody's research project because as a dental student or as in a dental school environment, they have to have so many research projects done so they can continue to get their grant money and so on and so forth. So go ahead and get on somebody's research project, help them in any way so you can get your name on that paper, because that's like weight. Secondly, I want to encourage you, if you are a young dentist applying to endo, go and visit the schools. Take time out, maybe on a Friday or Tuesday, and say, hey, can I hang out in the clinic? Try to become friends with the residents and see where you can help and assist. And that's going to help increase your chances of you getting into the program, because I don't know if you ever heard the parable that Jesus talked about, the judge and the lady, and the lady kept worrying the judge, and the judge finally did what the lady asked. And sometimes that's what you got to do, man. You got to keep worrying these people, keep knocking on the door, knock, and eventually they're probably going to get tired of you knocking, and they're just going to let you on in. So definitely you want to continue to be aggressive when it comes down to that. Now, don't be a pest like that, but you want to make sure you are letting them know that you're very interested. This is something you've always wanted to do. And if you get an opportunity, shadow at an endodontist office. Go to an endodontist office and see if you can shadow, maybe assist on some cases and things like that. Get on somebody's research project and see what they're doing. Visit the dental schools. Try to get to know who the program directors are. Ask them, is there anything you can help them with on the particular research or something like that? And that'll definitely help you get your foot in the door. All right. So I don't know if we have any other questions out there, but my time is up. I just wanted to drop on here just for a few minutes just to let you guys know just a few things about endodontics, answer a few questions, and just encourage you. No matter if you are in dentistry or pottery or a teacher or, automotive mechanic, man, I just want to just encourage you, man, never give up on your dreams. Never, ever give up, man. Right now, I'm living the dream, man. I'm able to not only do endodontics, but do it at the highest level possible. And not only that, it's so cool that I get a chance to see and treat a lot of celebrities here in Atlanta. People fly in to see me. I get an opportunity to be able to just encourage so many people around the world with my cases and just being able to, be a light, man. A lot of people just need light in their lives. And it's so dark with what's going on in the world. It's so dark with what the media and politics and everything that's going on, man. I just choose to be a light, in a dark world. And that's, to me, that gives me hope, that gives me peace, and that encourages me to be able to wake up the next day and look forward to something great that's going to happen to me, and something great is going to happen to you. So if you don't know, on Facebook, I do a Facebook Live just about every morning on my way to work, probably in between 8:30 and 9 a.m. Check it out, man. I whatever God puts on my heart, that's what I talk about. And people have texted me, people have written me and say, man, how did you know that I was going through that? I talk about race, I talk about relationship, I talk about finance, I talk about, investments, I talk about insecurities. I even talk about some of my insecurities. I talk about, how I was able to eliminate, I had about $350,000 in student loan debt, and I had about another $350,000 in practice startup, about $700,000 in debt. How to eliminate that under 10 years, man, and I'm not killing myself to do it. I talk about keys on how to do that. So a lot of different things, man, I talk about live. Unfortunately, I can't answer any questions because I'm actually driving and going through to work. But you'll find out that a lot of things I talk about, the topics, are the things that you are currently dealing with, or somebody that's dealing with it. And by the grace of God, he just dropped these keys from my heart into yours so that, you'll be encouraged and you'll be able to be an encouragement to somebody else. So, man, I love y'all. I'm praying for y'all. I pray you have a blessed week. Stay safe out there. This is Dr. Rico Short, the root canal specialist to the stars. Peace.